Okay, here we are live. It's very late. I seem to be going later and later every night. Dr. Mary here, day 12 out of 100. Today, I would like to talk about a recent study that the world knows about now in regards to IV vitamin C and sepsis. So there's a Dr. Merrick who was not expecting the results that he had with his septic patients in the ICU. And they had about 47 patients. And so it was a small study, but essentially he found that every single one of the people in his study who had sepsis, not only did they not die with the use of high dose vitamin C, but they had no multi-organ failure, no kidney failure. They didn't die from sepsis. And so again, when he started the study, he didn't expect to see the results that he had. But since childhood, what I would like to share with you is I've grown up with a mentor and an amazing physician named Dr. Charles Mary Jr., who is a pioneer and who has been using intravenous vitamin C for 40 years. And so he used high doses of vitamin C on all of his patients when they entered the hospital. And he, to prove his point, showed that very sick patients have a very low level of vitamin C called subclinical scurvy. So he would replenish their vitamin C not only on arrival, but during their time in the ICU. And he's told me that he's never had a septic patient die. So to have your mentor tell you that they've treated numerous amounts of patients who haven't died is a pretty incredible feat. So not only do I believe him because he's an incredible doctor, but he's my dad, so I don't think he would lie. But the beauty of it is that sepsis affects anywhere from 15 to 19 million people a year. And if 60% of those patients die, and all of my dad's patients lived, and all of Dr. Merrick's patients lived, there may be, and there is, quite a bit of hope in this simple vitamin, that it's so hard for people to believe that something so simple could work and have such value, but it is miraculous, all right? And it's something that you should consider and you should read about. What I am concerned about is that there are 4 clinical trials, which honestly, it's probably the most amazing thing to happen in our lifetime and for my dad to see, that all of his hard work is paying off and that they're finally doing studies. My concern is this, however. They are using a maximum dose of 10 grams of IVC in a 24-hour period. That's 10,000 milligrams total intravenously. Now we know there's exponential rates levels that will get into the cell with intravenous dosing versus oral dosing. And I'm extremely grateful that they're not going to muck up these studies. And, you know, in the past, Linus Pauling had professed that he thought that IV vitamin C could cure many viruses and many diseases. And when Mayo and these other studies were done, they used oral doses of vitamin C. And hence you have this entire, 20 to 40 years of people saying it doesn't work. Well, actually, it was because they had the dose wrong. So my excitement is somewhat blanketed by fear of the same thing happening again. And when it comes to vitamin C, this is the most important thing you need to remember. The dose of C that's needed depends on the strength of the fire or the inflammation that's in the body. So in septicemia, when someone is nearing multi-organ failure, kidney failure, and then the spiral of events that takes place, I'm not sure that 10 grams is going to be enough. It's a start. Its progress is slow, but I'll take it. I'm ecstatic, and it's only more good to come. And I pray that after they do this study with 10 grams, they do the next study with 20, the next with 50. Because again, the dose of vitamin C that's required is dependent on how much inflammation is in the body and how big the fire is. So when you ask yourself what dose is the maximum, we know that there are studies out there to prove that 150 grams, that's 150,000 milligrams, have been proven to be safe. No adverse effects. So what's the harm in trying this very inexpensive, extremely effective, and really just simple drug or vitamin? So if you have a sick loved one, I pray that it's not sepsis, but let's start from the beginning of when you get sick before you ever get that ill and use vitamin C as you need it. I hope you have a great night. Hope you take your vitamin C, and sorry it's so late. Forward this to your friends, share the page, and we'll be talking about menopause and hormones and the things that people have chatted with me about. Message me about more topics you want to know about. And if you need IV vitamin C, you know where to go. Good night.